Medicare has released a new Medicare plan finder. It's there up here on the screen. And I'm going to take you through the new platform. It has problems, and you're going to have to watch very, very carefully in order to try to avoid some of the problems that I really, really am uncomfortable with, especially for people who are new to Medicare, people who don't know, who just go to their senior center and ask for, a volunteer's assistance, because there are certain things in here that I'm very uncomfortable with, and we'll get onto them now. So by introduction, my name is J.O. Thank you very much for watching today's video. I've written 7 editions of this book called Maximize Your Medicare. It's there up on your screen, or it will be. Yes, there it is. That's the website to the screen. You can get it on Amazon.com. Be sure to subscribe to the free newsletter. In addition to these videos, certain little snippets. Some people like to read information actually in today's society. The 2020 version, the edition, is going to be published by Skyhorse Publishing. There's the cover there. It's available for pre-order. Stay tuned to this channel. You're going to have special pre-order offers to get discounts that don't exist otherwise. Let's go back here. So this is Medicare.gov. This is the official federal government website for Medicare. You can create your own account here, and I'm going to show you, how to, or what way you may not want to. Okay, so, and you can explore here, get started with Medicare, for example. Well, let's see if I can get this correct. Yep, there we go. So, as as it churns here, you can get started with Medicare, et cetera, et cetera. The technical rules, they're not wrong. They're not wrong. Are they a good way to follow to get recommendations about what you should do, right? And that's a big difference. There is a difference between what a person can do, and that's complicated. There are rules, there are complicated enrollment rules, etc. You can look on YouTube, you can look on this channel. There are rules and exceptions, and many exceptions to the rules, and getting them right is important. What ends up happening is, people, in our experience, is that people are so relieved that they got the rules of enrollment right that they don't think through, okay, what should I do? What should I be doing on top of this? What's the cost? What's the overall cost? Maximize Your Medicare is about trying to get the maximum amount of benefits per dollar. It's about money. I mean, I'm a financial planner, I'm a certified financial planner. It's about money. It's always about the money. And it's not only about the money today, but under the things that we can control and reasonably, foresee how to control that going forward. So let's go to the new plan finder now. Okay, so you can click this here as I've done, and it's going to bring up a new page. And this new page is going to give you, and it's going to almost encourage you to create a new account. Now, you need to be careful here, right? Creating a new account is fine, but what's going to be included when you create this account is going to be a full accounting of your billing history. That's a double-edged sword. First of all, that's good in the sense that, you can look at it conveniently online. I get that. I understand that. There's a reason, rationale for it. Okay. The flip side is this is now going to be online where someone else can also access it. And I'm not going to say that this is going to be the way that, all people like me, your insurance agent, the insurance company, who else? The volunteer at your senior center or library. Okay, we all use this tool, but not necessarily once you have created, not under your login. And the reason is that there is information, the private information. So there's something called HIPAA right? And this is kind of like the federal guideline to information privacy about your health matters, right? There are two types. Personal identifying information called PII, personal health information called PHI. It doesn't really matter. The point of it is that there's private information here that should not be shared with others. As a matter of record, right? As a matter of record, we've just completed a period over here where I've had to go through all of the Medicare Advantage and prescription plan providers and agree. We always have to agree every single year that before we represent a plan, that we're not going to share this information with others. We're not going to give insurance carriers more than the minimum standard so that insurance carriers do not discriminate, which they will not. Don't get me wrong, right? I'm not saying they're attempting to discriminate. My point is we're not allowed to use this your private health information to steer you in or out of a particular Medicare Advantage plan. That's against the rules. The issue with creating this account then is that ultimately you could be inadvertently sharing this with someone who should not have access to it. Okay, and so for this, the rest of the period here, and this is the very first stop of what I don't necessarily love about this new setup, right? Which is that this here looks like I should just be creating an account, and you'll be able to see it. I'll click here. If you wanted to do that, you can see it right from the get-go. What you'll be putting in here is a bunch of, create one now, and you can see it here. If you wanted to create this account, you're going to be sharing this private information. And that's okay for today if it's only for your own private use. Okay? But not necessarily for me. For me, this is my opinion, right? Because of the data privacy matter, alone, I don't necessarily want to be putting in my prescription stuff in there. So what I'm going to be doing, what we are going to be suggesting for 2020 is we're going to just continue without logging in. And here's the next step. Okay, so now we're getting into the weeds anyway, a little bit more. Find a Medicare plan. And blah, 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 learn about Medicare options, view plans. I know what type of plan I want. So let's just go here. Now, this is a little limiting because in the past, what you've been able to do is see both Medicare Advantage plans and Part D plans together all at once. And now it's clear you're only going to see either Medicare Advantage plans or Part D plans. It's just created an extra layer of work. And the reason it's created an extra layer of work is because maybe I don't know whether or not I'm going to choose a Medicare Advantage plan or whether I'm going to choose a Part D plan and Medigap policy. Okay, and we're going to go through each of these selections, but let's now just go to drug plan. This is very common that we just choose a drug plan. And this can be any zip code. So let's just, this should be Chicago. Yes, it is. Cook County, Illinois. And there we go. Do you have a Medicare card? Yes. What's your date of birth? Now you can see what I'm saying, right? Immediately, actually, all you really care about is the fact that you have a Medicare card. We don't need date of birth here. It's not pertinent. So I'm going to put in 01/01/1953. Yes, thank you very little. I know this, right? Meaning that I can only chance blah, 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 blah. Okay, so this is just basically verifying that I'm Medicare eligible. Do you get help with your costs from one of these programs? This is an important part. Okay, meaning that if you get Medicaid, for example, it is very important to include this here. Okay, if you get SSI, If you get Medicare savings program, which is if you have assistance towards your Part B premium, for example, right? If you get extra help from Social Security, meaning you don't get Medicaid, you don't get Social Security income, you don't get you're not part of the Medicare savings programs, you can still get extra help. For the people who are not certain, I highly encourage you to try to see whether or not you qualify for extra help. The savings are substantial under prescription drug plans, and the solutions that we're going to come up with here, the answers that are going to come from Medicare Plan Finder are going to be different. They will be different if you accept extra help or if you did not get extra help from Social Security. For today's exercise, we're just going to choose I'm not sure, meaning that we're going to proceed as if we don't get extra help. So it could have been either one of these two. That's fine. Do you want to see your drug tests when you compare plans? Of course we do. Etc., etc., etc. How do we normally fill your prescriptions? I highly encourage both. Highly encourage both. And the reason is that different pharmacies and mail order companies are working differently with the different plan sellers, the different insurance companies that offer Part D plans. This is complicated. So you want to have both because I'm trying to make sure that you get the maximum flexibility. Okay, let's continue. Okay, so I'm going to put in a few random prescription drugs. And these are very commonly known. Some may apply to you, some may not. Okay, so let's take it, and you'll see this is, they've maintained this. Okay, very popular medication. You can see you can choose amongst the dosages, the quantity, the month. It's fine. They have done a very nice job of kind of filling in kind of like the most commonly prescribed dosage, quantity. So I added this one. Let's continue to add, and I'm just going to talk here. It's very important if you use a generic to put in that generic medication name. Levothyroxine, for those of you, hypothyroidism, right? It is a generic, very well-known one for a drug called Synthroid. If you take levothyroxine sodium, do not put Synthroid in there. Do not put Synthroid in. And the same thing can be said for all generics versus brand name drugs, meaning that if you take the generic version, be sure to put the generic name in there. Okay. All right, let's continue. These are two fairly inexpensive medications. Let's just add something a little trickier. You can see here by the fact that I have no script. This is not my first day. These are eye drops for persons, for example, who may have glaucoma or something close to glaucoma that is resulting from diabetes. Here it is here. You can see it's a solution. Sidebar here, eye drops, creams, topical creams, inhalers. You get one of these three, you got to be pretty careful here when you're selecting either Medicare Advantage or prescription drug plan. You should be careful generally, right? But one of these three here, even if you know other people that have it, these can be trickier. Let's add. So let's just stop here before I put in too many more. 3 medications, etc. And you can change it. Good. No problem here. Let's say done. Now we get to choose pharmacies. This is Cook County, Chicago. Not going to have any shortage. Right smack in the middle of town there, near Miracle Mile. I went to school in the South End, a substantially more challenging physical location. But let's just choose. This is a name that many will know. This is a name many will know. Now, consumer tip, you can do as you wish, but if you travel at all, I generally, for practical reality's sake, try to choose a national chain. Not necessarily because I'm not paid by a national chain for that. I get no sponsorship for a national chain. But the practical reality is, let's say you're from Chicago and you go to Arizona in the winter. It rather than have Bill Bob's neighborhood pharmacy may not exist in Arizona. So you're smart enough to understand the application and why logic here. So we say done, and on we go. So 27 prescription drug plans available. Okay. So you can see here, I generally start by changing the sort plan. Lowest monthly premium is of almost no use, right? I understand it's the cheapest one for the month. Your important fact is the estimated annual yearly drug cost. Estimated yearly drug costs. Okay? That doesn't include your premium, which is an awful change. It is an awful change. This is why I don't like the output. Right away, I don't like the output. Because the entire point here is to minimize your total cost that you have to pay. That means your deductible. That means your co-pays for your different medications. It also includes premium. So the fact that this number here does not include the premium inside here is a huge problem for me. Huge. The amount of work you're going to have to do in order to come up with which plan is best is going to differ. You can see it right here, right? So I know these two plans very well. And by the same token, I'm not saying this is the plans for you, right? This is not financial advice. But you can see the challenge here. This one has higher premium, lower retail pharmacy costs. This one has a lower premium, but higher cost under retail and lower under mail order compared to this plan. And now you see the problem. This is the challenge here, because I've given you 3 medications, right, with the two of the largest nationally based pharmacies in the third largest city in the United States. We all don't have access to this exact set of plans with that simple a set of medications in this large physical location. And now the information that we're being given here is insufficient. You can watch other videos; they're still good. That, in other words, I'm gonna have to redo them, but you can see what ends up happening down here. Yeah, so if somebody says, "Well, I get more, I pay more. I'm going to pay more because I'm going to get more." Okay, you get it down here, higher premium, yet still higher estimated costs, and much higher for mail order. And you can see how complicated it gets. It gets a lot more complicated and very quickly. Unfortunately, the way that this new plan finder works is this number here is of very little use and is going to create confusion, saving precious dollars. It's not right in the scope of things. This is not that big a deal. $14. Okay, so they differ in $1.70 a month, and this times 12. Right, so less than $25 a year, and yet you pay more by $15 a year. Pretty darn close. You can see how competitive it is. You start changing your prescription list. You start changing your physical location. Now it's going to get complicated. Let's see here if this is of any help. And this is the thing, is lowest drug cost. So let's just see here. Yeah, and of which this also doesn't help you. Because when you change to lowest drug cost, again, it doesn't include your monthly premium right here. Well, guess what? Yes, this costs lower, but you're also paying now, in this instance, $12 more a month. What can I tell you? So that's the short and end of it on why. So now what is good here is we can now switch to Medicare Advantage plans. Now we'll just say that you live in that same location and you have those same medications and the same pharmacies. What happens here? Now what it's going to show you is it's going to show you all of the Medicare Advantage plans available in Cook County, right, in that zip code. 42 Medicare Advantage plans. It is not uncommon. Big locations, highly populated, Chicago, where else? Miami, for example. You'll see almost, and I want to say it's almost 50 plans in very, very populous locations. 42, that tells you how complicated it is. This sort order doesn't help me. This sort order doesn't help me, but let's just, because now what we have done here, right, these selections don't really tell me enough. Okay, this output here isn't really helpful in the sense of yes, let's just continue with lowest drug cost. Estimated yearly drug cost, 0, good. But now it's not really saying any estimated drug costs. So you can see these medications under these plans, right, which is the full set of plans, right? And I'm not going to get into what Medicare and Medicaid plan is. It's a specialized type of plan for those people who are dual eligible. And you can see now this tool has become less usable in turn from the practical reality point of view. Okay, and comparing Medicare Advantage plans using this tool, it works only to tell us what the set of plans actually is. Does it actually get us to the actual selection process? The answer ultimately is no. And I can tell you that because we help persons from all around the country reach out to us. They say, okay, how am I supposed to weed through this many plans? I'm getting tons of advertisements. I see tons of commercials. There's an infomercial, et cetera, et cetera. It seems like hourly on my cable TV. And it's true. This is not going to cease. Of course, this is going to continue. And you see these extra little things, benefits. And then let's just click on one. And you can see how you're going to be able to compare these side by side when you live in Cook County and you have 42 Medicare Advantage plans available. Tough stuff. Hopefully you've gotten some guidance. Be sure to be careful about putting your personal information on your medications, because if we had done this when I had an ID, now it's attached to my ID. And now I call up the insurance company. Now I go to, the senior center where there is a volunteer. Now, someone shares it with me, I have to keep it private. I have to. I've already signed. I can tell you this already, right? Agents, if we're to represent a plan, whatever this Medicare, whether it be a prescription drug plan, a Medigap plan, or a Medicare Advantage plan, we've already signed an agreement already, right? Saying, look, I'm not going to share this with anyone. There can be inadvertent issues though as well, right? You know this. You go to a computer at a library, and for whatever reason you haven't logged out correctly. You clicked the wrong box and it saved your name and password. My goodness. Tough stuff. Last point here, and let's just go back here to the home page. Yep. So let's just continue. I'm going to bop into here, which I know we've already seen, which I've already reviewed for you. So what's happening here is we're going to pull up the homepage again, and we're going to continue without logging in as I had hoped. View plans. I know what I want. Let's just go to Medigap just for a moment. For those persons who are looking for Medigap guidance, you couldn't get, my sympathy, my empathy any more than here. Because now I've tried to view Medigap policies. And let's go back to Cook County. Now it's showing you the 11 Medigap options. So Plan F, Plan K, A, L, N, B. Thank you very little for that. It doesn't correctly or fully, should say, I should not use correctly, but fully explain how to choose amongst them. Crazy people write books about it. Crazy people get quoted in the news about it. Crazy people, are going to have new editions, about it, right? Clearly, but these aren't not necessarily wrong, right? In the sense of, yes, Medigap Plan N, $87 to $176. Let's just go to see companies, and you'll see the issue here. So now let's click on see companies. Yes, there we go. This is a mess. This is a mess. So first of all, I don't love it when a government website says, okay, the pricing is unknown. Okay. And this also is not exactly right. And this is only the first layer of stuff I don't like here. Right? Meaning these companies, yes, at the minimum, these companies exist. And to be candid with you, I haven't looked to see the full set of this. And I'm not necessarily convinced. You can see here. It's only showing you a partial list. Oh, oops. So right away, you can see how many sellers there are. You can see how many they're not telling you which ones are showing you at which prices here. Okay. Do we know? Does my firm know? Yes, we have access to it live. But let's just go to any one of these companies. And it doesn't matter. Today's not an endorsement of any company, good or bad. Let's just call it Humana Benefit Plan. Now, here's the second issue. They're not telling you about what cost. They're not telling you about the cost of Medigap Plan N, right? They're not comparing it across all of these carriers. And then in order to get more information, you get sent to the official corporate generalized website for Humana Inc. Now, nothing against Humana Inc. In fact, I have sat on a board of 3 to 5 people as on an expert panel answering questions from consumers. There's no problem. Humana is the second largest carrier of Medicare Advantage or Medicare or prescription drug plans in the country. Okay. However, my point here is that this site here didn't really add anything to the selection process at all. We'll stop here. We'll have more videos about the Medicare Plan Finder and some going to give you some other practical things that you can use. You can go to these two websites, gh2benefits.com, maximizeyourmedicare.com. There's a contact form. If you want us to do this for you, you can ask us your first questions for free. We'll be able to, as we have done for many people on a nationwide basis. Hope you've enjoyed today's video.